I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lipo, Gyno, and beyond. Today I've got 36-year-old, just 36-year-old gentleman from California who flies to me for Gyncomastia and beyond surgery and my expertise. We will be doing Gyncomastia and beyond, which means more than just Gyncomastia. He's got these puff titties right here, which is fine. We could just take that out if he wants, but he wants full liposculpture. We're going to do the chest, we're going to do the full abdomen, top to bottom, neck to nuts, as I say. We're also going to flip him over and do his mid to lower back to continue the lower abdomen all the way to the back to get this nice and tight. We're going to get the venous dimples here in the back and the paraspinal muscles through a stealth incision here above the butt and right in the middle of the back itself. Turning them to the front, of course, we're going to do 360 in that area. And here we're going to do stealth incision in the armpit at the 6 o'clock position by the nipple areola, inside the belly button, and 2 inside the groin. He will need drains in the more dependent portions, 3 of them to be exact, 2 up front and 1 in the back. When I saw him last night, he flew in. We're also going to add a nipple reduction because his nipples they're this big. And he says, yeah, I was going to ask you about that. And I said, yeah, we're going to do that. He wants this 3 types of definition I do. There's mild, moderate, and intense. He wants the intense, which means he wants that midline linea alba, that intense semilunaris, that V to P, as I say. We're going to scope the lateral obliques. We're going to get up here and enhance the serratus muscles here. We're going to give them that great hockey stick look there. Of course, I said we're going to reduce the nipple size. We will be getting out this gland. These glands, we think that the right side is bigger than the left. Once I do everything, just going to whittle this down from a big quarter pounder to a little White Castle slider, and we're going to define all the muscles involved, which is the lats, the pecs, the serratus, the 6-pack abdomen, 2, 4, and 6. I'm going to mark them in a few minutes. Empty this lower abdomen below the belly button, give him that good V here, and enhance this lateral obliques. And again, the back we're going to do, we're going to sculpt the lower back, the butt, and the paraspinal muscles. Fat, we're going to do Renuvion. First we're going to do Renuvion J plasma to tighten everything up, and we will be lipofilling depending upon how much we have, but I know we're going to do the pecs up here. We're going to do the delts up here. A little bit of the lats. I want him a little bit stronger here. Looks like he doesn't swim much. He doesn't do the butterfly stroke. So I want to get him a little bit better here. Maybe the biceps here, and maybe the butt. I'll see what he's got here. Maybe a little bit in the butt, and look at the venous dimples here. Tighten up your butt muscle. These are the venous dimples here. We're going to carve those, and maybe a little bit of the butt, depending upon what we have, of course. What else can I say? Nipple reduction, all under local anesthesia. Let's go. I tell people they're going to look naturally unnatural. I want to give him some volume up north here. So want to do the lats for you. Let's see. What's your most important muscles you want enhanced?
Upper chest, deltoid. I'd say bicep would be least most.
Bicep would be least most.
Yeah, so
Gotcha.
If you had extra and you wanted lats.
Put your lats. I agree. Here, the etching, 6-pack, 2, 4, and 6. Empty that. You get this, I'm going to indent this really nice. And then, just kind of do all this stuff. Save the lats here. The anterior delt, the middle posterior delt, the biceps, which are low on our list. Anterior, middle, posterior, the lats, as I say. And then we pump you up.
I want to pump you up.
Alright guys, so now we're doing the Vaser. You may get a little, what I call a hit and run. Yeah, a little hit and run. Every once in a while. But if it's persistent, let me know.
Look to your left as far as you can, man. Yeah, thank you.
Give me good 3 minutes. Got it?
How many minutes?
3.
Gotcha.
So now we're melting the glands, melting the fat. Make it easier to get it out without causing any concavity. Also melts the fat. But it still makes the fat live. So we will be what's that?
Purifying it.
Purifying it and getting the good fat out. And we'll stick it in wherever you want it, depending on what I get. Okay. Right, so now I'm etching the lats here. And I'm getting the space. I love this space between the lats and the pecs. So this is the lats and this is the pec. It's right on in there. That's the beauty of Vaser. It's ultrasound, so it does not harm the blood vessels nor the nerves or the muscle. All it does is melt the fat. Like a sonic wave, like a boat. Finding those fishies. Alright guys, so now what I'm doing a micro-air power-assisted liposculpture. I've got a 4mm Mercedes cannula. I'm really sculpting. I'm very methodical with what I'm doing, so I don't go haphazard. I always go from one area to the next like I do every single day of my life. So right now I'm just going underneath the areola, the nipple, and getting, really whittling down this gland. Alright, now, lift up that, there you go. Get down a bit, Remember, this guy's just under 200 pounds. Right, 198? 180. So, not gonna have, you know, not like some of the guys they operate that's 240 pounds. So, and sure, give them shit. Just go to the gym. Everybody just writes in my videos, just go to the gym. Yeah, he does. But you know something? Maybe he just doesn't have the genetics, you know? Maybe he just doesn't have the ability with his life to eat right and go to the gym, you know, for 10 hours. Maybe he likes his pizza and his beer on weekends. I don't know. Maybe he doesn't just want to eat nuts and berries. So now what I'm doing is, got my fingers, my smart hand, and I'm etching the lats to the side. You are going to flip them over and do his back. Getting some beautiful stuff out. So now I'm etching the space between the pecs and the lats, and really emptying the space beautifully. And he's getting right here. And as you can see, there's no bleeding. It's a combination of my pre-op and my intra-op medicines I use. It's my secret. Do some nice videos. Step it up, Rainey.
Oh well.
Step it up. You're not in Texas anymore. You're not in Kansas anymore. Blow me away with this. I'll give you other doctors, friends of mine, mainly in South America. You look at their little Instagram. Nobody really does YouTube, and I don't love Instagram. I don't think Instagram really tells the story. I like YouTube. Where do you find me? YouTube or Instagram?
I'm the original on YouTube.
You're on YouTube, yep. That's where people find me. Alright, so now this is Renuvion, powered by J Plasma, helium gas, with a radio frequency spark. And it tightens the skin. Perfect. As I say, like a virgin on prom night. Okay, so we lipoed him. We got, oh my God, how much? Oh, so you're gonna add another 12. Got 33, 34, 35, 36, like 37. 3 liters, 700 of atom, and that's what we're gonna do his back. That was the whole front, and we're gonna process the fat for fat grafting. But now what we're doing is we're just very gently removing these glands. You always have to remove the glands. The right side we kind of knew was bigger than the left. And so we're gonna pop these suckers out. Here we are. All I'm looking for is the glands. Perfect. And this right side is going to be bigger than the left, but we'll see that in a minute. And that's it. That's beauteous. And look in here, always there's little stalagmites and stalactites and shit like that. Beautiful. So my neighbor in the DR was Vin Diesel.
Oh, really?
Yeah.
Oh, nice.
I didn't see him, but he had a lot of guards around his house. That is it, I believe. Let's look around. Clean up a little bit. I wasn't into the Fast and the Furious movies.
I've never watched one of them.
Yeah.
Not the best acting in the world.
Yeah, I wasn't into them. I was more into Rocky. All right, nipple reduction. Curved scissors black.
Right here.
Oh my goodness. You been taking memory pills, Clarence?
I've been trying, man. I don't know.
Ginkgo biloba.
No, it's all natural, brother.
Probably ashwagandha. Ashwagandha. All right, Dr. Lipo, Gyno, Dr. Lipo, Gyno, and beyond. End of part 1, the anterior part of this 36-year-old gentleman from California who comes for me for my gynecomastia and beyond expertise. Under local anesthesia, through stealth incisions in the armpit, by the nipples, inside the belly button, and the groin. We sculpted his chest and abdomen and to the sides, and you'll see the back in a few minutes. We got almost 5 liters out of him. We purified that fat, and we put in just over 1 liter of purified fat in his pecs and into his delts. We removed the glands, of course. This is the right side, which was much bigger than the left side. And we did a bilateral nipple reduction as well as icing on the cake. We used closed drains in the lower abdomen, which are attached to these bulbs, which will stay in about a week. All self-absorbing stitches, except for the stitches inside, outside securing the drain. He looks great. We did the pecs, the lats, the delts, the 6-pack abdomen, 2, 4, and 6, the midline linea alba, the semilunaris, and the serratus muscles as well. And we etched out his lower abdomen and his fupa around the side to his back, which again you'll see in part 2. So if you have gynecomastia and you want my dedication and my results and my commitment to you, you call me Dr. Lipo, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.